Today we're with Dr. Nicholas Mezitis, and he's with the Castrop Center here in Athens, Ohio. And he deals with endocrinology, and that's a mouthful. It's kind of hard to pronounce.
Right.
But,
long word.
Right. Dr. Mezitis, explain to us exactly what the endocrine system is.
So the endocrine system is all the organs that relate to communications within the body using substances which we know as hormones, because the body has various ways of communicating messages. Some of these are communicated by the nervous system, different way of transmitting a message. In the case of the endocrine system, we're using the humors, we're using the hormones, we're using certain substances that are produced by specific glands, and they then go to various cells and give a message depending on the particular function of the gland.
Most of us, I think, when you talk of hormones, we're thinking of things like estrogen and testosterone, and I believe that I read that that is included, but there's more than that to the endocrine and the hormone situation.
Absolutely, because those that you mentioned are hormones that people are familiar with, the estrogens and the testosterone, the sex hormones. But in addition to those, we have thyroid hormone, people know about that. Insulin, people have heard about that. Those are two very well-known hormones. There are also hormones that are produced by the gut, by the intestine, and they have their functions that assist us with digestion. And then there are other chemical substances, hormones that are produced by the brain in order to regulate the function of the glands. So there are all sorts of levels of control and command in the system.
The other better known hormone is probably insulin coming from the pancreas.
Sure.
And I believe that I read that a deficiency in one hormone can create an imbalance that will affect the other hormones. Is that
Yes.
common?
Yes, it is, because they're all linked. It's one large system, pretty much like a car would be functioning. And you need several parts that are all doing a synchronous type of relationship in order for this car to be moving smoothly. And if one of them is not functioning 100%, you, the driver, experience the fact that it's not smooth, you can't accelerate properly, maybe your brakes don't work 100%, you know that the car is not running the way it should.
Right. Now, one of the things that there are a lot of people out there suffering from type 2 diabetes. That's for people my age and such usually. And then you have type 1, which is people that are born with it. Is there a difference in the cause of one as opposed to the other, type 1 and type 2?
Yeah, well, that's a good question. I mean, there are two types of diabetes, so we make the distinction based on the fact that insulin is entirely lacking in the type 1 diabetes, which means that these individuals, being that they make almost no insulin of significance, cannot really survive without being given insulin as an injection. Usually is how we do this. So therefore, if they don't have the insulin, if for some reason the insulin supply is not available, they are not able with their own production to survive, so they would die. And that's type 1 diabetes. And you mentioned that they're born with it, and we know that genetics may play a role, but there are other factors that we don't entirely understand. They speak about viruses, they speak about other elements. So there are triggers also that set things up so that someone who may be born with a predisposition to damage their pancreas and destroy it may, after 5-10 years of life, maybe after a year of life, maybe after 15 years of life, gets into that predicament because something triggered the cascade, and it might have been a virus, it might have been. So we're not entirely sure about all of the factors that play the role, but we do know that in the end, type 1 diabetes requires insulin to be given. Type 2 diabetes is a little different because there we have other factors. We have genetics, of course, and the predisposition playing a role, but a lot has to do with the environment and lifestyle and behaviors, which there play a triggering role, pushing things over the brink.
Mm-hmm. Now, as personally, I'm a type 2 diabetic, and a couple of the tests that I know are supposed to be quite important is the ALC and triglycerides. Now, what is the function? What is ALC, and what are the triglycerides, and how is the diabetes affecting those?
Right. So now there's a hemoglobin A1C, which is a test that we do in order to judge how well the blood sugar has been performing, let's say, over the course of the previous 2 to 3 months. So it's an index of glucose control. And what it reflects is the sugar coating of the blood protein, which is known as hemoglobin. And a certain component of that hemoglobin gets sugar coated depending on the sugar levels in the bloodstream. And by judging the amount of sugar coating on that particular protein, the hemoglobin, we can then make certain statements about how well these people are doing with their blood sugar. We might even be able to make a diagnosis of diabetes on that number based on and saying, this number is way out of line, and chances are, or we believe very strongly that you have diabetes based on this particular score. So that's something that we also use to monitor our therapy, to judge if someone's been doing well with the medicines we're giving, if we need to make a change. I mean, it's a very useful index that we have at our disposal. In addition to that, we have, as you mentioned, triglycerides and cholesterol and other elements that also depend on blood sugar control, because blood sugar is just one marker for how well the body is doing its housekeeping, right? Because when we eat, the food that we eat has to be taken apart, it has to be put back together again, has to be disposed of. There's all sorts of functions. Pretty much like when we go shopping, we come home, we have to cook, then we have to put food on the plates, we have to make sure all the kids sit down to eat, we have to make sure we get fed, how much people are going to eat, what goes on each plate, all of that has to be decided. And that role of the housewife, so to speak, is the insulin's role. So it makes all these decisions from the shopping, from the element when food comes into the house, so to speak, and what happens with it, and how it's cooked and everything else and delivered, all are functions that relate to insulin. And we are very sensitive to the fact that in order for insulin to do its job properly, we have to have a certain lifestyle that facilitates insulin in its work. And the same thing, we can mess up the housewife, by turning off the lights, and messing up with her oven and making sure not delivering the stuff that she's requested in order to do the cooking. This is very similar to what happens here when we interfere through our lifestyle with insulin, its production and its function.
Now I know that if I eat potatoes, and I've heard bread, the carbohydrates, they jacket the sugar up. Is there a food that is an absolute no, don't ever eat if you're diabetic?
I don't think there's anything which is an absolute no, but it depends on the amounts. So it's like saying a little bit of salt, and it's okay with a meal. If you take and you dump the whole salt shaker in there, then you probably can't eat it. Okay, so something analogous happens with the sugar. A little bit of sugar mixed in, let's say, with your oatmeal, and the oatmeal has a little butter with it and so on and so forth. There's a nice balance. What people do is they become excessive. So they might take a milkshake, it's almost half a gallon of milk, and they want to take that, and then they'll have apple pie with that, and then they'll take a slice of chocolate cake because there was some type of a buffet. And people get to be excessive. They kind of lose it, so to speak, just because things are available. And then after they do all of this, then they get in the car and they drive home, and they go and watch 3 episodes, on television. Say, well, this is a total mismatch. I mean, first off, you ate all of this stuff, which is excessive, and number 2, you don't really have the need, based on your caloric requirement and your lifestyle and your car and everything else. For all of this, you're not a lumberjack. So why are you putting away 6,000 calories? You see? Because it tastes good because it's there and I can do it, And basically I've got nothing else to do, or we were socializing or hanging out, but those are not excuses, you know what I'm saying? So right now we have a lifestyle which is not compatible with our particular gene makeup. It might be that for somebody on a different planet with a different arrangement, they can have sugar all day. But the way we're set up and primed, most of the people in the United States come from a stock which is set up to work a lot with little food. And that's how they survived, and they were pioneers, and they made it, and the guys that couldn't handle it, they died. If you take now that pioneer stock, and you say, good, we have a new idea now. You can eat freely, and there's no shortage on that, and you don't have to work. Because we've got that taken care of, somebody else is going to do it. So you can hang out and you get a check every month, you're in great shape. So that's what happened to the Indians, and they're all destroyed. Yeah. If you take a look in the Southwest, the Pima Indians on the reservations and so on, they've been demolished health-wise but 300 miles across the border, they have relatives who are blood relatives, then they're Maricopa Pima, and they live like they used to 500 years ago. And they don't know what a car looks like, and they walk miles and miles, to get to water and to do what they've got to do. And they're as thin as a rail, and they don't know about diabetes, they wouldn't even know how to ride it. And the other group, so they're right there, and that's the best example we have.